and Child Ecology, with co-sponsors the Institute for Public Policy and Social Research and the Institute for Health Studies at Michigan State University. I want to thank our new chairperson, Dr. Karen Wagner, if you will rise. She's new to East Lansing, so people welcome her. I'd like to thank her for her continued support for these seminars. I also want to thank our co-sponsors from the Institute for Public Policy and Social Research. Dr. Doug Roberts would have been here, but he's in New York today. But we have Ms. Anne-Marie Schneider. Anne-Marie? Disappeared. Okay, behind the pillar, Anne-Marie Schneider. And the Institute for Health Studies, Denise Holm and Carol Parker Lee, who are both unable to attend today. The seminar topic was selected by legislators from both parties who agreed to serve on an advisory panel. Healthcare was high on the list of topics deemed highly relevant to policymakers this year. We sought feedback from Steve Angelotti, State Senate Fiscal Agency, and Steve Stock from the House Fiscal Agency, Bob Stampley, Denise Holmes from the Institute of Healthcare Studies, and Charles Milligan from the University of Maryland in Baltimore. Furthermore, this seminar is building off the work of many people, and some of you may have been members of task forces around the long-term care issues, and we would like to acknowledge your work. We also had a lot of help from the Public Institute Network for Family Impact Seminars. And this is a national network of about 24 states that each do a seminar like this for their respective state legislators. And their help was very helpful for us to put this together. Finally, I'd like to thank Mark Meadows, Representative Meadows' office, for helping us access the Mackinac Room. At a time that we are concerned about the revitalization of Michigan's economy, we cannot ignore healthcare as it is one of the key factors influencing our economy today. Long-term healthcare affects all of us. Those in need of long-term care services, such as a man who's celebrating his 92nd birthday on Sunday, Uncle Balks from Kalamazoo, who is fiercely independent and chooses to live on his own with some home health services. It is also an issue for his niece who lives in Okemos, who's my son's art teacher, who is very concerned about whether he's going to make it living alone. And she also worries about whether she and her husband will one day be a burden to their children. The point is that long-term care is an issue for all of us families in Michigan. We are here today to learn more about how we can create an environment that enables us to have quality of life and choice in Michigan. And what are some of the effective and efficient ways that we can go about this business? Today, I'm pleased to present speakers who will address the future is now long-term care needs of Michigan families. Dr. Laurie Post, Assistant Dean of the College of Communication, will be informing us about the changing demographics in Michigan and the added value of implementing criminal background checks for people who provide services in long-term care settings. Mr. Jim Verdier from Mathematica is here to share information about issues Michigan may face in moving towards long-term care managed care. Each speaker will be allowed 25 minutes, followed by a few minutes for questions and answers. We will have an opportunity for in-depth discussion at the roundtable session, which will begin at 1 o'clock. We will convene two groups. Dr. Schomburg from the Department of Family and Child Ecology will be facilitating the group with Dr. Post. And Mr. John Hazelnickel from the back will be the group facilitator for Mr. Verdier's group. In your packet, and this I feel like a nag, but it's so important to us, so I hope you'll help us, is this bright pink evaluation form. I hope that you will be able to help us by completing that. It helps me summarize some data as I go and get support for having these seminars next year. We also have a little treat for you, for those of you who can complete the form. Now, I'm looking for Mr. Stampley. Is he in the audience? Okay. But before I do that, I'd like to acknowledge the help of many people. Laura Bates, who many of you have been in touch with, has worked very hard on putting this seminar together. Laura. And Gianelle Rivera, standing next to her. Jennifer Lawson, who is with United Way, but she's also a student in our department, and she's come back to assist. Tiffany Martaccio, who is back there in black, and Toko Oshio. Rebecca Hansen, who's sitting at the table, and Kathy Cusick from Gibson. So with all of this help, we are able to really get this going. I'm going to start with introducing Dr. Post to you. Dr. Lori Post is the Assistant Dean for Research in the College of Communication Arts and Science, Assistant Professor in Telecommunication, Information Studies and Media, Senior Research Fellow at University Outreach and Engagement. Her research focus is violence prevention. To this end, she has several federally funded research projects, including the Michigan Program for Background Checks and Vulnerable Medicaid Populations. The former is one of 7 Department of Health and Human Services pilot projects aimed at developing a standardized background check system that will weed persons with disqualifying criminal histories from gaining employment, providing direct care to persons in long-term care. The latter project generated population projections out to the year 2020 to estimate the number of elderly and disabled persons coming down the pipe, working population burden, and violence implications. It gives me great pleasure to introduce you to Lori Post.
Thank you so much. I want to thank everybody here from the Michigan Legislature. I also see lots of my partners and colleagues from the various states of Michigan agencies like the Michigan Department of Community Health, Department of Human Services, and also Michigan State Police. I would also like to thank the folks from Michigan State University and people in general that are interested in long-term care and Medicaid issues. Okay, I want to begin by talking about the history of this project and talking about how I came to this place. And the bottom line is that people in long-term care are very vulnerable, and people in long-term care, they need to be protected. So back in the year 2004, some folks came to me from the Michigan Department of Community Health and said, hey, we're thinking about applying for one of these pilot studies that's going to be funded from the Michigan Department, or the Federal Department of Health and Human Services. And so I partnered with the Michigan Department of Community Health, the Department of Human Services, and Michigan State Police, and we secured a grant. We were one of 7 states, and we have the privilege to develop a pilot study in this year 2030, and you see we've become more of a column as opposed to a pyramid. So this here is our working age population, and that working age population has to support these people down below, and it also has to support these people up here. And the reason that the population has changed so dramatically is because we have longer life expectancies, people are delaying childbearing, people are having fewer children, and so we know for sure by the year 2030 there will be relatively smaller working population to support the elderly. And more people are going to be crunched between the children and the parents generation. So when we have a top-heavy population, what this means is that we're going to have fewer caretakers, we're going to have a smaller tax base, and right now this is exacerbated by an economy where the younger population frequently leaves to get employment in other states. Okay, I want to show you a measure here that
demographers like to look at. Here we see, this represents here the ratio of elderly to the working population. You can see how it was in 1970, goes all the way up here out to the year 2030. You see how dramatically it's going to increase. So by the year 2030, most counties will have more elderly people than they will have working populations. And something of big concern also is that the rural counties are outpacing the urban counties, with the exception of 2 or 3. And here I want to show you the elder dependency ratios between 1970 and the year 2030. And you can see the darker that it gets, the more elders that we have living in a particular area, and the higher the ratio is. And I also want to point out that today I'm talking about mostly Michigan as an aggregate. However, I have done all these analyses at the county level, so if anybody's ever interested in individual county level data, you could contact Esther, and Esther knows how to get a hold of me, or contact me directly if you would like. Then I want to show you 3 counties here, Iosco, Leelanau, and Presqu'île. And I also want to talk a little bit about migration. There's sort of a myth that we all retire, we're age 56, 60 years old, we all go to Florida or Arizona and play golf for the next 40 years. It actually doesn't happen. Most people don't migrate after they retire. And then also a lot of those people who do tend to migrate will go someplace when they're in what we call the early or the new old. We have the middle old, and then we have the old old. So people tend to go away when they're newly retired, but they'll come back when they're in their middle retirement.